the Munson Healthcare Virtual Press Conference. Today is Tuesday, March 23rd, 2021. Next slide, please. In addition to these press conferences that we try to do weekly, we are encouraging you to stay informed by signing up for the Munson Healthcare e-newsletter, following us on social media, and visiting munsonhealthcare.org, where we make frequent updates to our website to keep you informed of all the latest COVID-19 information. Next slide, please. I'm happy to introduce today's speakers. Joining us again will be Dr. Christine Nefsey from Munson Healthcare, Wendy Hirschenberger from the Grand Traverse County Health Department, Lisa Peacock, who represents the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan, Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10, and I am Diane Mihalik, Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. So as usual, we're going to welcome Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare, back to give us the latest stats and talk about some CDC guidance and travel updates. Dr. Nefsey, welcome.
Thanks, Diane. Good morning, everybody. I do want to start with just our regular update on the numbers. I've been reporting over the past couple of weeks a slow increase, and I'm sorry to say that that increase has gone up and continues to rise a little bit more steeply. Currently, you can see there the totals for our region, but I think the important numbers are our percent positive, which is up to 7.3%. Just as a check back, we were at 5.2% last week. We have 365 cases per 100,000. Last week, we had 240. Next slide. That is impacting our inpatient numbers. So we currently are at 53 positive inpatients. We had 29 at the same time last week. So the percent positive we are seeing in our communities is impacting our inpatient numbers at all of our hospitals across the region. Next slide. And you can see there the graphic of it, where we had that very nice decline in numbers and then a slow uptick and now a more exponential uptick. Next slide. So as always, we do like to talk about what we can do to mitigate those numbers. And first and foremost would be vaccines. I am happy to report that Munson Healthcare has now provided over 50,000 doses of vaccine in a number of ways. We did our mass vaccination clinics. We have been distributing vaccine to both our employed network as well as our independent practices. So those are our primary care offices around the region. And we have been partnering with our health departments as we have throughout the pandemic to ensure we support them as best we can in administering the vaccine. Next slide. You are also, I'm sure, very aware that you can get vaccine at several retail pharmacies. That is a federal government allocation that is separate from the state and separate from what we are getting. The state is, in addition, allocating to health departments, now primary care practices as well across the state, health centers, and the hospitals. That distribution is based on a social vulnerability index. So basically those of our community that are the highest risk and perhaps have lower access to healthcare do get prioritized so that we ensure we don't leave anyone behind. Next slide. So here, just as a reminder, you can see what the tiers were for distributing the vaccine. And you can see as of April 5th, the vaccine will be available to every member of our state that is 16 years of age or up. And again, that's only because the vaccines have not yet been tested in children. And so that's where that age comes through. But we will be opening up very soon to all Michiganders. Next slide. Again, I think everybody's aware spring break is here coming up. And we understand people will be traveling, and we just want to remind everybody that if you do choose to travel, we would ask that you do it safely and take every step you can to protect both yourself and others. So if you are eligible and can get a vaccine, we would ask that you do get vaccinated. It is recommended that you get tested before you travel to ensure that you're not traveling while you're sick and maybe asymptomatic. As a reminder, the masking is not necessarily in place in every place you may go, but it is the safest thing to do and the right thing to do when you travel. So wherever you go, we would recommend that you wear a well-fitted mask over your nose and your mouth when you're out in public. Avoid crowds. Stay at least 6 feet away from people who are not traveling with you, who are outside of your immediate group. And once you get back, we are recommending, as consistent with the CDC, that you get tested 3 to 5 days after your return, and you stay quarantined regardless of what your test results were for a week after travel. If you do not get a test, the full 10 days of quarantine is recommended. Next slide. So again, follow all state and local recommendations, and there are some states that are much more lax in what their recommendations are. So really we would say that would be the bare minimum, and the better recommendation would be to follow the guidelines set forth by the CDC. If you were exposed to COVID-19, or if you have any symptoms at all that could be consistent with COVID-19, or if you have tested positive, we would say please do not travel. Next slide. This is just a reminder that masks are required on most forms of transportation, and especially if you're going through transportation hubs such as airports or train stations, that kind of thing. Again, the avoiding crowds, washing your hands, wearing a mask, always recommended. We would recommend that you bring extra supplies of both masks and hand sanitizer when you travel, so you always have it readily available. If you are going to go out to eat outdoors when you can, get carry out when you can, or bring your own food. And again, if you are traveling with other people or to meet other people, we would recommend that you stay with those that you know are being careful or have been in your immediate social circle already. And if you are not in that situation, to practice the same gathering safety measures of masking and staying socially distanced. Next slide. I do want to give an update on our visitation policies for long-term care. So those come often both from the state as well as CMS. And the new recommendations are, or updated recommendations, I guess, are depending on their vaccination status and their contact history. A new long-term care resident will likely need to quarantine for 14 days upon their first arrival, which means for the first 2 weeks they are there, they would not be able to receive visitors. In those instances, our staff does make sure to try to use any technology we have available so that those patients can connect with their loved ones during that quarantine period. Next slide. For others, we are opening up visitation, and the requirements are that you make an appointment first, that just like when you come into the hospital or a clinic, you will need to answer health screening questions before you can answer. We do ask that people give us their contact information and keep a log so that if we do need to get in touch with you for contact tracing purposes, we have that information. And while you are in the facility, you must wear a mask, you must follow our hand hygiene protocols, and continue to practice social distancing and any other personal protective equipment rules that are in place for that particular patient or that particular long-term care facility. Next slide. When you do call to make your appointment, it's probably a good idea to ask what the visitation instructions and requirements are so that you are prepared. Each facility may be a little bit different, and then depending on what's going on for them, they may have additional restrictions in place that they need to comply with. So arming yourself with the information before you go is always a good idea. These visitation restrictions do change, and they change frequently depending on the facility's COVID-19 cases, the exposures that may have happened, our county positivity rates, which we've already said are going up, which means that the restrictions will be stricter. So please call ahead so that you can be prepared and plan your visit as best you can. Next slide. These are just the numbers for Munson Healthcare's long-term care facilities so that you have that information for yourself if you need to call before you go.
Thank you, Dr. Nefsi. That was a
You bet.
great update. We do have, before we move on to the health department updates, we do have one question coming in, and I thought now would be a good time for you to answer because you were talking about travel guidelines.
Mhm.
The question is, if you get vaccinated, should you still get tested before you begin traveling?
Yes, yes, you should. And the reason is severalfold. One is we know that at most the vaccines are about 95% protective. That means 1 in 20 people, despite being fully vaccinated, could still get COVID-19 and they might be asymptomatic. So because we're still in a pandemic and there's still widespread um, uh, disease, it is really important that you fully understand what your status is. So it's obviously much less likely that you would have it, but it is still a chance. And if you're going to be going someplace on a plane or in a car with others or to a place that you may be around other high risk people, it is recommended that you should still get tested.
And Dr. Nefsi, could you also just restate at what point are you more protected? Because now that they're opening up the vaccine age groups to younger individuals, 16 and over, um, if someone were to get a first dose of the Pfizer or
Mhm.
Moderna, and they wanted to travel for spring break and maybe they were just getting their first dose
Yeah.
recently, what are the guidelines around that?
Yeah, that's a good point, Diane. So thank you. So we do know that when you get your vaccine, it does start to give you partial immunity, but specifically for the 2-dose vaccines, which is right now the majority of what we have, it takes a full 2 weeks after your second dose to get to that full 95% immunity. So while getting a first dose and a second dose vaccine series is a good idea, and we would recommend even that before you travel. It gives you partial protection, but it doesn't give you full protection. So 2 weeks after your second dose or 2 weeks after one dose of a one-dose vaccine is the time you need to be fully protected.
Great. Thank you, Dr. Nefsi. I'm sure we'll have more questions coming in related to the information you just provided. But for now, we are going to move on to allow the health departments to give their updates. So next, it's my pleasure to introduce Wendy Hirschenberger, who is the health officer for the Grand Traverse County Health Department. And Wendy does not have her video turned on, but she does have a few slides to go through. So welcome, Wendy.
Thank you. I actually don't have video on my work computer, so that's why you get the picture. Um, so I just wanted to give some updates on progress with vaccine and testing through our health department. I'm happy to report that the Save Your Spot option is now open to all for Grand Traverse County. That's anybody who lives or works in our county. Regardless of your eligibility, anyone who is 16 and older can now fill out a quick survey and then they get in the queue for an appointment. On the back end, we are able to sort based on the eligibility and priority groups. But it's a quick survey. It's at gtcountycovid19.com/vaccine. And then once you fill that out, you are contacted via email. So everything is electronic. And it gives you a link to schedule based on your eligibility and based upon when we have appointments available. Right now, people should expect maybe a week or two wait from when they sign up to when they're going to get a link to actually get an appointment, as some of the groups that are currently newly eligible are a little bit larger, but we are making good progress with the vaccinations. We also now are testing at the Cherryland Mall testing site. It is now rapid antigen testing. The testing is free, it's drive-through, and it's very quick. You get through your results within 15 minutes, and it's delivered through a patient portal that is set up through Hanu Labs. If you test positive, you are then asked just to come right back around through the line, and you get a PCR test so that that can be sent to the Bureau of Labs at the state. And so it's a confirmation test of the rapid antigen, and it also will then allow any positives that come through that to be tested for any variants in our area, which, as we all know, is important as we're starting to see more of that throughout the state. It is really important that if people feel like they have any symptoms at all to get tested and to isolate. And now that we're seeing the numbers go up, as Dr. Nefsi explained, which is very accurate for our county and our region, the testing is more important than ever. Next slide, please. So I also wanted to talk a little bit about vaccination distribution within Grand Traverse County. So this week, the health department's mass vaccination site at the Haggerty Clinic will administer over 3,000 doses. They're about half and half, first dose and second dose. The cumulative number of doses that we have given as a health department through these clinics as of yesterday are over 25,000. And by the end of the week, we will be nearly at 28,000. And then I wanted to cover the vaccination rates for Grand Traverse County residents. So these numbers are the cumulative efforts of not only the health department, but Munson Vaccinations, local pharmacies, and others who are vaccinating in our community. So overall, as far as vaccination coverage for anybody who's received at least one dose, we're at 41.4% for the initiation, and then 28.5% have had both doses. And those numbers vary by age group. You can see on the chart. So for the 75 and older, we are doing very well. We continue to be at the top or close to the top in the state, with 86.1% of that 75 plus population receiving at least a first dose and nearly 71% of a second dose. And then in the 50 to 64 year age group, which is kind of the current age group focus, we are at 40% who have initiated, and then 20% who have completed that second dose. So we are also planning to do some clinics out in some of the more rural areas of the county in the future months, understanding that maybe not everybody either feels comfortable coming to a mass vaccination site or can get into town. So that is something that we were currently planning on. I think that's the update I have for today. Thank you.
Great, thanks, Wendy. So that's exciting news about your new software platform and the number of vaccinations you're giving out. So thank you so much for that update. That's really great news. Next, it's my pleasure to welcome back Lisa Peacock, the health officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan. Lisa, please give us an update on what's happening in your districts.
Good morning. Sure, I would be happy to. So in both the Benzie-Leelanau and the Health Department of Northwest Michigan District, we are able to have enhanced our software over the past week. So that's become much more efficient of a process to both pre-register and to schedule. So we want everyone who is interested in being vaccinated to complete our online forms. They can be accessed on either health department website. That gets you into the scheduling queue. And similar to what Wendy said, we really are expecting a week or two wait. We get new requests every day, but we're also giving thousands of vaccines every week. So the line does move pretty fast, and that's a great way for us to be able to reach out to you, is to have your information there and readily available. We are welcoming anyone age 16 and over to go ahead and complete the form. We're still processing according to priority groups, and right now we're focusing on the 50 and over population. Certainly getting in any stragglers that we have in previously eligible populations, including our seniors that are 65 and over, as well as our frontline workers in 1A and 1B priority groups. The seniors also received a postcard in the mail in the Northwest District last week, and will be receiving that in the Benzie-Leelanau District this week, which went to all registered voters age 50 and over. That gives them information about how to pre-register for vaccination. So we're hoping that these multiple strategies will help us to reach people that we haven't previously reached. Both agencies are implementing multiple strategies to address the needs of the vulnerable. We're redistributing some of our vaccine as we received some of the first allocations of the Johnson & Johnson vaccine. That lends itself to some additional strategies that haven't been quite as convenient in the past. And so we've been able to partner with the hometown pharmacies in both Suttons Bay and Honor to receive some of those allocations so that they can work through the seniors and adults that they have on their waiting lists. And then the Central Drug in Charlevoix, downtown in Charlevoix, has been doing a great job utilizing some of our redistributed vaccine, as well as the Spartan Nash Family Fair pharmacies in both Mansalona and Gaylord. So that's just a mechanism that we can use to increase our capacity to create additional access points throughout some of our smaller communities around the region. We are also going out today in Emmett County with our EMS partners to reach about 25 homebound individuals. And so we just continue to explore the best way to address the needs of people who may not be able to attend a traditional clinic. Same as both Dr. Nefsi and Wendy, we are seeing, definitely an increase in cases, outbreaks, and positivity rates across our counties, across the region, and across the state. Outbreaks have typically been related, and cases have been related to the school population or workplaces. And again, it's contact within 6 feet with each other. Oftentimes, most of the time, we're seeing positive cases in people who are unvaccinated. We know none of the vaccines are, no vaccine is 100% effective in preventing illness. So certainly we've seen a couple of positive cases in people who have been vaccinated, as is the case with all vaccine preventable diseases. But it's a good reminder to all of us that as the vaccine eligibility opens up, to please get vaccinated as soon as you can. Get in our scheduling queue, share the information with your friends. This really is the light that we've all been waiting for that will lead us to the end of the tunnel. And I think that this resurgence in cases and positivity just reminds us all that COVID is still lurking in our communities, and it's waiting for that opportunity to pass between people within close contact that don't have other protective factors like being vaccinated. Both agencies are doing a great job, as are all of our partners across the region, in increasing those numbers of people who are vaccinated in Northern Michigan every day. Northwest surpassed over 25,000 doses last week, and Benzie-Leelanau is approaching 10,000 doses this week. So we're working hard to get that information out there. So I think I will leave it at that. Both of our websites are listed on the slide, and I'm happy to be available for questions.
Great, thank you, Lisa. We'll have you back in just a minute for the Q&A session. But last but not least, from the health departments, I'd like to welcome back Dr. Jennifer Morse, who is the Medical Director of District Health Department number 10. Dr. Morse, please let us know what's happening in Health District 10.
Very similar to everyone else. We've increased our eligibility to everyone who is 16 and older, regardless of health conditions. You can go to our website, dht10.org/schedule, or call the number listed there if you're 18 or above. We are putting those that are 16 and 17 on a wait list and calling parents. We have to make sure that they're scheduled for the appropriate vaccine, just because only Pfizer is approved for that age group. We have gotten over 52,000 people vaccinated with at least one dose. We are working on plans to utilize the Johnson & Johnson vaccine with our homebound residents and others who are higher risk and better suited for that vaccine due to its easier transportation and storage, and also just that it's a one-dose series. We are, as everyone else has said, seeing increased positivity, high increases in cases, and again, positivity rates and testing, and many facility outbreaks, jails, workplaces, some schools. So, I think we just are feeling very hopeful with the vaccine, a bit burnt out on all the different precautions, getting a bit fatigued with all the precautions, that I think it's just leading up to maybe some drop off of some of the mediation compliance. And so we just really need to rally right now and hold it together. We've also had quite a few variant cases reported in some of the local counties. Not very many cases, but we've had different counties that have had those occur. And realistically, likely there is a very large number of variant cases that we just don't know about, especially with the increases we're seeing and the outbreaks we're seeing. So again, that is definitely a much more transmissible and contagious virus. So we really do need to take this seriously until we can get over this hump. So our contact information is on the slide there, and I know it's on your last slide as well. So really nothing has changed of great import with our vaccinations. We're just really pushing along. We have first vaccine clinics on the weekdays. We have second dose clinics on the weekends, and we just keep pushing along, utilizing the National Guard and a lot of wonderful volunteers from the community. So that's it.
Great. Thank you, Dr. Morse. And while I have you on, we do have one question that came in. I'd like to invite all of our panelists to come back now for the Q&A session. And for just a reminder, for those of you who are actually on the Zoom meeting, you can submit your question via the Q&A feature. Or if you are watching us on Facebook, you can submit your question via Facebook and it will get to us. But Dr. Morse, we do have a question coming in about the vaccination process. Should we get tested before we get the shot? Because this person that's asking has not been tested.
No, I mean, if you have symptoms consistent with COVID at this time, it certainly is recommended you get tested, or if you've been recently exposed to someone with COVID, it's definitely a good idea to get tested, but you do not need to be tested, otherwise just to get the vaccine. I think what Wendy was describing with Grand Traverse was just an opportunity to offer testing to those who are getting vaccinated as a way to see how many people in the community may be infected and not know it out in the community, to get a better idea of that prevalence. So it's not that you need to get tested before vaccination. It's just something that's good for the community to have available to them.
Great, thanks, Dr. Morse. And of course, anyone who is planning on traveling should utilize those testing resources in your various areas. The next question is for Wendy. This is specifically coming in from the Traverse City area, and there's a person who is over 64 and has not been able to get an appointment yet. Will the age of the person be considered when signing up on the wait list?
Certainly, yes. We are similar to what Lisa Peacock described. We are prioritizing based on current eligibility. So yeah, they're searching based on the whatever answers you put in there and what the current eligibility is. We would definitely be prioritizing those 50 and over.
So great. So whoever it was that asked that question via Facebook, we recommend that you go to the information at the end of this slide where the Grand Traverse County Health Department information is there, and use their new scheduling software to try to get in line with that. Wendy, while we have you as well, Dr. Morse mentioned some variants that she's seeing in District Health Department 10. Are you seeing any of the variants in Grand Traverse? And then I'll also ask Lisa to comment on that as well.
That's a great question. We have not had a variant reported to us yet from the state lab, but as Dr. Morse explained, we certainly suspect it may be out there, which is part of why it's very important that anybody with symptoms does get tested, and that they follow through with the PCR test, because those typically are sent to the state lab and then can be tested for variants. It does take anywhere from up to 2 weeks for the results to come back for the variant testing, however. So as far as from a case investigation or isolation quarantine perspective, that does make it challenging there. So we would definitely still follow through on the normal mitigation measures as soon as we know of a positive test, regardless if it's a variant or not.
Great, thank you, Wendy. And Lisa, what about your area?
Yeah, so we have received reports of a couple of different cases that were sequenced as being the variant case. However, like Wendy said, those results come in after the isolation and quarantine periods are over. So there really isn't anything different that we do with those individuals locally at that point. It really is a process of surveillance and understanding what the virus is presenting like across the state. So I think that we are all approaching this as if every positive case were a variant case or contagious, and it's just a very good, important reminder for all of us to maintain those important mitigation measures as well as isolation and quarantine requirements.
Great. Thank you, Lisa and Wendy and Dr. Morse. Dr. Nefsi, this next question is for you. You mentioned that the hospitalization rates are going up, and you mentioned that there were over 50 people hospitalized across the Munson Healthcare system as of today. Are you seeing any differences in the types of patients, whether that be age group or severity of illness, and are we still seeing a lot of patients on vents?
Yeah, so we saw a difference between the spring when this first started, that there were many more patients on ventilators than in the fall surge we had. So this one seems to be much more like the fall surge, that we have not as many patients on ventilators, but certainly some very ill patients, many requiring ICU level care, and most of them requiring some form of oxygen and support in their respiration. Additionally, we are seeing much younger patients than we did, and we think that that's likely related to the fact that we had such a hard push to vaccinate many of our older community members. So that is the only other difference, is many of the patients we're seeing hospitalized now are much younger than what we saw in the fall.
Great, thanks, Dr. Nefsi. One related question. Someone is asking, when the hospitalizations were up in the past, some other surgeries that were quote unquote non-essential were pushed back. Is there a certain threshold where this may happen again?
Well, when that originally happened, that was mandated by the state for a lot of very good reasons. There was a shortage of PPE and a concern for equipment and ventilators and those kinds of things. What would be the issue now is really how full our hospitals get and the capacity we have in our ICUs and other high care units. So we've taken some steps to spread patients out across the system. So, they're not all, for instance, in Traverse City or at one hospital in one region, which will help mitigate that a little bit. But certainly, it just depends on how many patients there are and then the acuity level of those patients. So we have taken all the steps we can to mitigate that as a potential outcome. But, we would hope that that would not happen. I mean, obviously we have some room before we get to where we were in the fall, and we never would want to be, have to turn patients away for their care. But we don't know what the situation will turn into, and so we will address that as the time comes.
Great, thanks, Dr. Nefsi. The next question is for Dr. Morse. When might the Johnson & Johnson vaccine be more readily available in your district? And are they being held for certain members of the community?
So we do have it. We're trying to decide the best way to utilize it, and it is really, the goal is to prioritize it for certain groups, like people in jails, homeless shelters, homebound, those individuals where, again, we may have to go out to them. So transportation and storage is a concern because it does not need to be kept at as cold of a temperature. And also where concerns are higher regarding getting them the second dose. For those individuals where, again, going to a homebound individual, it takes a lot of time to vaccinate those individuals. So if you only have to do it once, it's just a lot easier. And for someone who might be in a jail or in a homeless shelter, you might not know where they're going to be in 3 to 4 weeks. So one dose is just a lot simpler and more reliable to get them fully vaccinated. So we are deciding on that. We have used a few doses of Johnson & Johnson in people who we've had concerns about allergies or adverse issues with the other vaccines, but that's just been on a very limited case-by-case basis. And those have been decisions I've made personally on each one. So again, that's been another situation they've been used, but we're still trying to decide the best way to utilize those.
Okay, thank you, Dr. Morse.
Mm-hmm.
There's someone in Otsego asking if they can actually choose which vaccine they will be receiving.
So,
I can answer since I haven't muted my phone yet, but just in our counties, it's whatever that, when you sign up for a clinic, it's whichever vaccine is there. The only difference would be if you're 16 or 17, it's going to be Pfizer for sure. But it would just be whichever that clinic is offering.
Do the health departments or the clinics let patients know ahead of time which vaccine they'll be receiving? And maybe, Dr. Morse, you can answer that first for your area. Are you letting people know which one they'll be receiving?
You know, I have to plead ignorance on that. I'm kind of in a helicopter mode when it comes to a lot of this. I don't know a lot of the intricate details with scheduling and things. So I think our health officers probably know a lot more about that. But the impression I've gotten is that oftentimes they don't, and it may change week to week because we don't always know what vaccine we're going to get. That, you know, what we might think we're getting Pfizer and it might end up being Moderna.
Lisa, is that the same in your area?
Yeah, that is the same in our area. We certainly will let people know upon request when they're scheduling what we plan to be giving that day. And usually it's scheduling just before the clinic, so we have the doses when we're scheduling. As we schedule further out, though, I agree with Dr. Morse. We don't always know what we're going to be getting. And we schedule the clinics with whatever we have. And, you know, I know that Dr. Meyerson, our medical director, his best medical advice that he shares very frequently is you should get whatever vaccine you can get first, because they're all really great. They have great safety and efficacy profiles. So,
right. And Wendy, is that the same in Grand Traverse County?
Yes, however, I can say that I would say 95% of the vaccine we have received, maybe it's closer to 99%, has been Pfizer. We are predominantly getting Pfizer because of our freezer capacity, and yeah.
Great. Thanks for those answers. The next question is for Dr. Nefsi, and this is related to some of the rumors or concerns about vaccine safety. So this question reads, I heard that these shots have caused complications and miscarriages. Is that true? And I have been, and why has this not been told to the public? And can it change people's DNA?
So it's not true, and that's why it's not been told to the public, because it's not true, and it doesn't cause a change in DNA. It's important that people understand if we had a medication or a therapy that changed people's DNA, we could cure type 1 diabetes, we could cure sickle cell anemia, we could cure certain types of cancer. So if we had that technology, I don't think we'd be using it for a COVID vaccine. We would be using it to cure some really significant diseases that impact our population significantly. So they do not change DNA, they do not change RNA. All it does is bring a message into your body that's transcribed and then it disappears. So we have no evidence that it causes any kind of miscarriage or infertility or any of those rumors that have gone around. In fact, the American Academy of Obstetrics and Gynecology has strongly recommended that pregnant women or breastfeeding women or people planning to become pregnant still get the vaccine because of the safety and efficacy and the concern that having COVID could have. So no data to support that rumor at all. And we do have more and more information from larger scale vaccines. I mean, we've given millions of doses. You know, we've given 3.5 million doses in the state of Michigan alone, let alone across the rest of the country and in the rest of the world. A recent study that just came out showed that the side effect profile was no greater than people receiving a placebo. Certainly what it would be expected with any other vaccine or new medication that we give.
Thank you, Dr. Nefsi. On a related note, someone's asking about a specific underlying condition that their son has, specifically autism. But if someone has an underlying condition or some other medical condition and they have questions about receiving the vaccine and specific, you know, health questions related to only their body, what should people do?
I would invite them really to speak with their primary care provider if they have questions. If you don't have a primary care provider, we have lots and lots of information on our website, as do the health departments, as does the state health department, and the CDC and the World Health Organization. Right now, the only contraindication to getting these vaccines is a history of having anaphylaxis. And even that with an allergist or with a primary care provider can be worked through. Most other disease processes are not a contraindication to getting this vaccine.
And I also want to also mention that Munson Healthcare does have an Ask a Nurse line, and that information is available on our website as well, and it may be on the last slide of this presentation. So if you don't have a primary care physician, you could call that helpline and try to get your questions answered that way. Thank you, Dr. Nefsi. I wanted to ask Dr. Nefsi about any word on AstraZeneca vaccine being, I think I heard on the news this week that they were about to apply for emergency use authorization. Do you have a status on that?
I don't. I know
Okay.
that it has been approved in some other countries. It has also been withdrawn for use from some other countries. There's some additional testing going on. It has not yet been asked for or looked at from the United States, from ACIP or the FDA or CDC here.
Okay. And next question is for Wendy in Grand Traverse County. There's someone specifically asking, saying that they have registered. They feel that maybe they've been waiting longer than they should have and want to make sure they're on the list. Should they register again?
Yeah, 5 to 8 weeks seems out of the realm of what our wait time is right now. So yeah, I would recommend they go out and register again at this point. I'm sure they'll get in much sooner. Or we do have a COVID vaccine email. I believe that's on our website as well.
Great. So people can just try to verify if they're on the list or not.
Yeah.
Okay. Dr. Nefsi and Dr. Morse, and maybe all of you can re-comment. Someone is asking, so vaccinated or not, should we continue to wear a mask no matter what? That may have been more of a comment than a question, but I thought someone else may have that same question.
I'm happy to address that. So, there's a couple of reasons to wear a mask. One is if you have asymptomatic disease or symptomatic disease and you wear a mask, that helps stop the spread from you to somebody else. And we do know with COVID-19 specifically that there are many people who are asymptomatic with this illness, but still can spread it. So because we don't know and we don't do daily testing and all of those kinds of things, and we are kind of out and about and working and socializing, wearing that mask, if you were an asymptomatic carrier of COVID-19, would help prevent you from spreading it. It also helps protect you from others that are in that same situation. So we know that this is a droplet spread, sneezing, talking loudly, singing, all of those other things. So those masks prevent the spread both ways. So you are wearing it not only to protect yourself, but I'd say even more importantly, to protect others around you. So that's why we would recommend that you still wear it. Part of, I think, the confusion for people is, we don't wear masks so we don't spread measles or, mumps or some of those other things that have, vaccines with similar efficacy. But the rate of those diseases in our communities are so low, the chance of actually spreading it to other people when you have most vaccinated for it is much, much lower. We have a very high rate of having this virus in our communities right now. So until we reach that herd immunity or a vast majority of people who aren't going to be able to get it and spread it, we have to continue to protect ourselves with masks and hand washing and social distancing. So I know that's a little confusing sometimes, maybe doesn't make complete sense, but that's kind of how it is. And that's why we see in other places when you have fewer people that vaccinate, you see a resurgence of some of these other illnesses because we don't have enough people in the community to kind of protect each other.
Thank you, Dr. Nefsi, for that explanation. Someone else is also asking, why do we call this a vaccine when it's not a remedy? It does not prevent the spread.
So I'm not sure I quite understand that question. So it's a vaccine, which means it prevents it in a vast majority of cases. So, so 95% efficacy, let's use that because it's a nice round number. means that even being fully vaccinated, 1 in 20 people could still potentially get the disease. That's because it's not 100%. Just like antibiotics, we receive vaccines for other illnesses. None of them are 100%. Nothing, I don't think, in life is 100%. So there is always that chance that 1 in 20 that somebody, even despite being fully vaccinated, could still get this disease and spread it. So I guess I'm not entirely clear what that person is asking. And I don't know in that case then if I
Yeah,
addressed it.
I think you answered the question. I think there's, you know, because we're talking about vaccination so much more now, I think people, you know, some people think that a vaccine is 100% effective. And, you know, I think we're all starting to learn as we go through this pandemic that that's not the case, but it is still the best thing to do to help protect yourself and others who are vulnerable. So we are actually out of time, and we will take any unanswered questions that have come in and take a look at those and see if we need to update our FAQ section on our website. But I do have just a couple of closing slides. I want to first thank all of our speakers today, Dr. Morse, Lisa Peacock, Wendy Hirschenberger, and Dr. Nefsi for joining us. It's always really great information and a lot of good updates that people are sharing. It sounds like we're making some really good progress with software scheduling and access issues. This is our full list of community resources that are available that each of our speakers have mentioned. This information, again, will be posted on our website, so you can access it at any time. If you are still looking to try to figure out where to get vaccinated, start with your local health department first. Look to your local pharmacies, and hopefully our primary care providers will begin receiving more vaccine as well. Next slide, please. Again, I want to invite you to sign up for the Munson Healthcare e-newsletter, follow us on social media, and again, visit our website for ongoing updates. I do want to also mention that we will not be hosting a press conference next week, but we will resume again on April 6th and hopefully have our health departments back in April and continue to learn about all the great work that's being done and the collaboration between all the health officials across the region. So thanks everyone for joining us today, and have a great day.